Hello and welcome to today's presentation regarding Medicaid enrollment for the Doula Pilot Program. My name is Rita Guido from CSRA, New York Medicaid's fiscal agent. I'm joined today with representatives from the New York State Department of Health. At the end of today's presentation, we'll be addressing questions. Some of the topics we'll review during today's presentation include a review of the basics regarding the Doula Pilot Program. We'll also be discussing how you can enroll and where you can find enrollment forms, as well as the necessary documents that will need to be submitted with your enrollment applications. At the end of the presentation, we'll discuss upcoming training opportunities in the future, and we'll also talk about reference materials. We'll follow that with our question and answer session. We're going to begin with some basics about the Doula Pilot Program. Instructions below are for doulas enrolling as a provider in the New York State Medicaid Doula Pilot Program. First of all, only doulas serving New York State Medicaid eligible clients who reside in Erie County and all of the zip codes in Kings County except for the following zip codes: 11207, 11208, 11212, 11216, 11221, and 11233 will be eligible to apply for enrollment in the New York State Medicaid Doula Pilot Program. Once enrolled as a New York State Medicaid provider, doulas will be able to bill New York State Medicaid for up to 3 prenatal visits, support during labor and delivery, and up to 4 postpartum visits provided to Medicaid eligible clients residing in the above-mentioned areas. Now, for more details about this Doula Pilot Program, you can go to the State Health Department's website at www.health.ny.gov/Medicaid/redesign/Doula-Pilot. Next, we'd like to talk about New York State Medicaid managed care. There are Medicaid recipients who are enrolled in Medicaid managed care programs throughout New York State. To become a doula provider for a New York State Medicaid managed care client, a doula must first enroll with the New York State Medicaid program. Once you're enrolled as a New York State Medicaid provider, then the doula can reach out to the managed care organization, the MCOs, that are participating in the Doula Pilot Program in your area to apply to join that MCO's doula provider network. So remember, you have to enroll with New York Medicaid first, then you can enroll in a Medicaid managed care plan. Next, we're going to talk about how to enroll in the New York State Medicaid program. So how do I enroll in the New York Medicaid program for the Doula Pilot Program? Well, the first step, step 1, is a required step. You need to make sure that you have obtained a National Provider ID number, or what's known as an NPI. You would get that number from the National Plan and Provider Enumeration System, or NPES, NPPES. That website is listed on this slide. It's nppes.cms.hhs.gov. The next step, after making sure that you have an NPI, is to step 2, which is also a required step. You have to submit an enrollment application for the Doula Pilot Program. And we're going to show you how to do that in just a few moments. You're going to go to the provider enrollment page on the emedney.org website and select Doula Pilot Program Provider Enrollment Form. You need to read and follow the instructions that are given in terms of completing those forms and all the necessary documents that have to be submitted with it. That's very important. you need to note that any applications that are missing one or more requirements are going to have to be sent back to you as an enrollee for completion. Additional enrollment steps for the doula pilot program. Step 3 is the applications review by the New York State Department of Health. So once you've submitted your application, that completed application is going to be reviewed by the New York State Department of Health. If more information is necessary in order to process your application, you'll be notified as to what information is needed and where you need to send it. It's very important to note here that your email address is very important. You need to ensure that the email address that you list on your application is correct in order that you can be contacted. This is going to be the primary method of contacting you if outreach is needed in order to obtain additional information from you regarding your enrollment application. So please make sure that you enter the correct email address on your application forms. Step 4, notification of determination by the New York State Department of Health. So after they have reviewed your application, a written determination of either approval or denial of the submitted application will be sent to the provider. It's going to be sent to you. If your application has been approved, you're going to get a letter. It's going to contain your MMIS ID number. That's the Medicaid Management Information System Identification Number. It's going to tell you the effective date when you may provide services to any of the enrolled clients in the doula pilot program areas, and any other information related to your enrollment. That's going to be sent to you in a letter. So it's very important that you follow these steps and understand the order in which they must occur. To begin your enrollment in the New York State Medicaid Doula Pilot Program, go to the MEDNY website at www.emedny.org. Next, choose the Provider Enrollment tab on the top row of the MEDNY homepage. Then select Doula Pilot Program from the list of providers that are located on the right side of your screen. This page of the MEDNY website is the link to the Provider Enrollment and Maintenance documents. So here you'll see a brief description of the Doula Pilot Program, followed by a link to the Practitioner Enrollment Form. That's the form you're going to complete to enroll in the Medicaid program. You'll also see another link to that document in the upper right corner of this page, so you can get to information through more than one link. That link on the upper right also tells you what your category of service number is, which is 0464, and you'll have to enter that on your application. Note that an application fee is not required. You will also notice there's a small printer icon underneath that upper right section of the page. That printer icon can be used to print all of the instructions that you see listed down below. So there's a set of general instructions for the enrollment form. You should read those through very carefully as you're filling out your enrollment application and make sure you follow the directions. There are additional instructions for the enrollment form specific to the doula program, and additional requirements and additional forms links. So it's really helpful to print out this section and have it handy and review it as you're doing your application. Next, we'll be reviewing the enrollment form for the Doula Pilot Program. Will give us an overview of the form and the instructions. It's very important when you complete your enrollment application that you mail your enrollment documents to the correct address. It's very important that you ignore the address that's printed on the enrollment form in the upper right corner. Instead, please mail your enrollment forms and any other required documents to the address at the bottom of this slide. You'll see a red arrow pointing to that, the actual address. It is the Bureau of Provider Enrollment, Attention Doula Enrollment, room A129, 431 Broadway, Albany, New York, 12204. So again, please ignore the address listed on the upper right side of the enrollment form and mail your documents to the address at the bottom of this slide. Next, you want to be sure to enter your 4-digit category of service for the Doula Pilot Program in the category of service field on the practitioner enrollment form. You can see the 0464 entered in the area highlighted with the red arrow. You want to be sure to check the New Enrollment box on the enrollment form. You'll see a red arrow pointing to it on the left side of this slide. You want to be sure to complete all items on the form unless the instructions note otherwise. You'll begin by entering your name in the applicant name field, exactly as it appears on your license or registration. So enter it in the order of last name, followed by first name, followed by middle initial. Next, you'll enter your NPI number, the National Provider Identification Number. Remember, you have to obtain that prior to completing this application. The next field is the SSN field, the Social Security Number field. After that, there's a row that contains license number information. You may leave those fields blank. Below that is the applicant's email address. That is a required field. And remember, we mentioned earlier that it's very important that you enter the correct email address, because that is where the state will communicate with you if you have left anything off or they have any questions. So remember to enter your correct email address on this form in this field. It then asks if you're enrolled in Medicare. The DEA number section, those fields may be left blank. Then it asks if you're affiliated with a group and what that group is and their group NPI number. Now remember that this is a fillable form. So entry of the information into the form online is going to prevent errors due to illegibility. So remember to try to complete this form online as much as possible so that it's legible. The next section is the address section. The first field is the correspondence address. This is where any letters or claim forms are going to be mailed. You do not enter a P.O. box in this section. It's not acceptable. We would like your attention to name, street address, suite, department, or floor number if there is one, city, state, and a 9-digit zip code. So we need the zip plus the 4 extra digits of the zip code. The county in which this address is located, the telephone number and fax number for this address. Next is the Pay To address section. This is where you would like your checks and remittance statements to go if we send them out on paper before you're enrolled to receive electronic fund transfer and electronic remittances. So again, you'll enter the address. Attention to street or P.O. box is acceptable in this section. Suite, department or floor number, city, state, and 9-digit zip code, county code, telephone number, and a fax number if you have one for this address. The next address on this page is the corporate address. This is where you would like your annual tax documents, meaning your 1099 forms, to be sent. And again, needs similar information, the attention to street or P.O. box, suite, department and floor, city, state, zip code, county, telephone number, and in this case, they're also asking you in the corporate address section for your email address for the corporate address information. So again, be careful when you enter your email addresses that you're entering them accurately. The next section of the enrollment application contains service addresses. So this is where the service is being provided. You're not supposed to list a patient's address as the service address, and you can also refer to the instructions for more information. But your service address could be your own office or the doula's home if there isn't a primary office available. You have room for several service addresses. The service address field here requires an attention to the street address, suite, department and floor number, city, state, 9-digit zip code, county, if in New York, telephone number, and fax number if there is one. You'll also be asked to enter the type of practice that's represented by this service address. So you've been instructed to enter individual in this field. The place of service field to the right of that has 3 choices: private office, hospital or nursing home, and freestanding clinic. And your instructions tell you to check the box that best describes this place that you've entered in the service address field. Again, you have room for several service addresses if you need to tell us about different addresses. If there isn't enough room on the application, you can attach an additional form. But do remember that the service address can contain your office, if you have an office, or the doula's home address if there is no primary office available. This next slide shows the additional sections for service addresses that can be entered in the application. The next slide is the disclosure of ownership and control. So in this section, you're going to enter the doula's information again, the disclosing entity or applicant. So this is the person who is applying to be enrolled in the Medicaid program. So you're going to enter the doula's name, NPI, the home address in this case, city, state, zip code, and that should be the zip +4, the social security number, and the date of birth of the doula in 2 digits for month, 2 for day, and 4 for year. Now that information is similar to what you entered earlier on the application, on page 2 of the application, but you'll notice that here you're being asked for some additional info such as the date of birth and to actually give the home address. It may be the same as what you entered earlier, but it does specify home address here. The next section is the ownership in applicant section. And you'll notice it does give some instructions here. It does say that you'll enter this information if required by this particular regulation, 18 NY-CRR. And these are found in your instructions when you fill out the application. There's a reference to get linked to that document. Here you're going to include any familial relationship to the applicant and any other owners such as spouse, parent, child, sibling, if any. The address for corporate entities has to include every business address, and again it refers to some regulations for more information. Now this information in this ownership and applicant section can, if in fact there is nobody else who has any ownership in the applicant, then you can either repeat the applicant, the doula's information in this section and enter either 0 in the percentage field as percentage of ownership or 100% in the percentage of ownership field. Or you can leave that section blank entirely if there is no reason to describe any other ownership per the regulations that are spelled out here. This next section, section 2, 3, and 4 on this slide, in some cases may be left blank, but in other cases, depending on the rules that are stated here in the instructions, may need to be completed. Section 2 is for ownership in other disclosing entities. You would complete this if anyone identified in section 1 has an ownership or a controlling interest in an other disclosing entity. Section 3 is the ownership in subcontractors. If the applicant has an ownership or control interest of 5% or more in a subcontractor, and an owner of the applicant also has ownership or control interest in the subcontractor, complete the boxes below. If those identified in this section have a familial relationship with a person with ownership or control interest in one of these subcontractors, complete Section 4. Section 4 is the familial relationship in subcontractors. So you would complete this if those identified in Section 3 have a familial relationship such as parent, child, sibling, or spouse with a person with ownership or control interest in one of the subcontractors that you identified in Section 3. Section 5 is about agents and managing employees. So for instance, office managers, administrators, directors, or other individuals who exercise some type of operational or managerial control over the day-to-day operations of the provider. Although it's unusual, if there are none, if there are no agents or managing employees, then the word none may be entered in the name field, the very first name field that you see below. You should include any familial relationships to the applicant, such as spouses, parents, child, siblings, if any, that have operational or managerial control over the day-to-day operations of the provider. If you do need additional space, you can copy this section of the form and enter the additional information on an additional page that you'll include with the application. Again, if there are none, if no one has operational or managerial control over your day-to-day operations, then you can enter the word none in the first name field here. Section 6 of the enrollment application asks that you read these questions carefully and answer yes or no to them on behalf of yourself as the applicant and on behalf of all of the individuals and entities that you may have entered in Sections 1 and 5 of the application, and on behalf of any entity in which the applicant has a 5% or more ownership. So read the questions carefully. They relate to things such as terminations in different Medicaid programs, Medicare, or other government or private insurance programs. They refer to crimes in question 2. They refer to individuals having their business or professional licenses or certifications revoked or suspended. And if you do have any currently pending proceedings that could result in any of the above stated sanctions for any of those individuals or entities. If you did answer yes to any of the first 4 questions, you'll need to complete and submit with your application the prior conduct questionnaire form. That form is available at the emedni.org website. The last question, question 5, you'll also need to answer that and submit any additional documentation if needed. Again, read this section very carefully and answer the questions that are asked. The last section of the application form is the signature and affirmation page. Read this section through very carefully. Here you'll sign it with an original signature, no stamps, after you print the form out. You'll enter the, also enter the name and the telephone number of the person who prepared the application, and you'll enter the date the application was prepared in 2 digits for month, 2 for day, and 4 for year. After you've completed the enrollment application, you'll also need to go back to the provider enrollment and maintenance page and refer to the requirements and additional forms. This section will tell you which additional documents you're going to need to send with your application. The requirements and additional forms section of the provider enrollment page tells you the additional documents you're going to need to submit with your provider enrollment application. So, you're going to need to send a copy of your doula training certificate. Or, if a certificate was not provided by your doula training organization, then an original letter from that organization that provided you with the doula training and stating that you have attended and completed their doula training course is going to have to be attached with your enrollment application. This letter has to be signed, dated, and on the organization's letterhead. It must be the original. It cannot be a copy. You'll also need to submit a doula training attestation form. It's form number 433402. The original signed and dated form affirming that your doula training in the core competencies has been completed. You'll also need to send in an electronic fund transfer authorization form, number 701101. You'll also need to send in an ETIN, electronic transmitter identification number, certification statement for new enrollments, form number 490602. And last, if you did answer yes to questions 1 through 4 in section 6 of the enrollment application, you're going to have to complete and include the prior conduct questionnaire form, form number 431001. You may also need to complete the OMIG, Office of the Medicaid Inspector General, Provider Compliance Certification. Confirmation notice for the OMIG Provider Compliance Program may be required. In order to determine that, you're going to have to visit the OMIG website. If you do need it, you're going to need to include a copy of that confirmation notice printed from the website, along with your enrollment application. This slide shows a copy of the doula training attestation form that we mentioned just a moment ago. So you'll have to fill out the fields that you see here. You'll fill out your name and the name of the doula training organization and its address and phone number, and note the minimum doula training requirements, the date you completed your doula training, and if applicable, the date recertification is required, and then print your name and then sign the form and date it, and send it to the address that you see here along with your enrollment application. This form is the certification statement for providers billing Medicaid. You'll need one of these to be notarized and submitted along with your enrollment application. And as you can see, it contains your provider name and your NPI number at the top of the form, and then down at the bottom your signature, date, your name printed, and your title, phone number, and email address. And then at the very bottom of the form is the notary information. So you have to send this original notarized certification statement along with your enrollment application. This next form is the electronic funds transfer authorization form. This also must be sent along with your enrollment application. It comes with a set of instructions. You need to complete the fields according to the instructions in order for us to deposit your money into either your checking or your savings account. Along with this form, you're going to need to send a voided check from your checking account or a letter from your bank. Make sure that you complete all the necessary fields and give us original signatures where needed. So once again, you must remember to complete all of the required forms and include them with your enrollment application. So remember to include a copy of your doula training certificate or an original letter from the doula training organization that provided you with the doula training, stating that you've attended and completed their doula training course. Again, it must be An original document has to be signed if it's a letter, dated, and on the organization's letterhead. You also need to submit with your enrollment application an original signed and dated doula training attestation form, form number 433402. That's going to affirm the doula training in the core competencies. You also must remember to submit, along with your enrollment application, the electronic fund transfer authorization form, number 701101. And you must remember to include the electronic transmitter identification number certification statement for new enrollments form, number 490602. In addition to the enrollment application and the required forms that we just discussed, there may be some additional forms and documentation which may be needed. The prior conduct questionnaire, form 431001, is needed if you answered yes to questions 1 through 4 in section 6 of the enrollment application. The OMIG Provider Compliance Certification notice for the OMIG Provider Compliance Program may be required. Visit the omig.ny.gov website to determine if the applicant or provider must comply. If yes, a copy of the confirmation notice printed from that website must be included with your application to enroll in the Medicaid program. Now it's time for some final notes and reminders. Be sure to respond to requests for additional information when you receive them. Any omissions will delay the processing of your application. Self-help documentation is available on the eMedNY website to help you through the enrollment process. Be sure to carefully review the enrollment form found on the eMedNY website, including all of the instructions, prior to completing and submitting the enrollment form and the attachments. Be sure to keep a copy of everything for yourself. We do have some upcoming training opportunities that are available. CSRA Provider Services has regional representatives that are available to conduct group and individual training and assist with a variety of eMedNY related topics. We also have training webinars and in-person training sessions that are going to be made available in the next few months. You should continue to refer to the training page on emedny.org's website for training and seminar offerings as they're made available. And if you want to request additional training on an individual basis, or if you need some assistance, you can contact your regional representative by calling the eMedNY call center at 800-343-9000 and let them know that you want some individual training or assistance from your regional representative. This last page contains the reference and contact information that we would like you to refer to. We've listed the eMedNY website at emedny.org. We've also listed the eMedNY Provider Enrollment website link. So this takes you directly to the provider enrollment page on emedny.org. We've also listed the Bureau of Provider Enrollment, their email address at providerenrollment@health.ny.gov. Next, the New York State Department of Health Doula Pilot Program website, and followed by the New York State Department of Health Doula Pilot Program email address, which is doulapilot@health.ny.gov. And last, the eMedNY call center at 800-343-9000. At this time, we're going to stop the presentation and move on to question and answers.
Okay, the first question says, will New York State be offering a doula proficiency exam and antepartum training? Currently, the training programs don't require either.
And the New York State Department of Health is not going to be offering a proficiency exam regarding the antepartum visit.
Okay.
Are we going to provide any training in regards to doula training? It's just the enrollment training that we're providing in the billing for reimbursement.
Thank you. They're asking if the slides will be available after the session and how can they be accessed. And we can discuss that if you'd like and figure out how we want to make them available. These are the only questions that I see coming through. Chat section, because some people may be entering questions in chat.
Rita, this is Jonathan Lang from the New York State Department of Health. I just want to remind folks that we are going to have a series of education and outreach materials made available regarding the pilot, and those will be found at our website, which is once again www.health.ny.gov/doula-pilot.
Thank you. One is asking, what is the doula payment rate for this pilot program?
Pilot provides for up to 3 antepartum visits at $30 per visit. The doula can also attend and help the mother during labor and delivery for a one-time fee of $300. That fee is only, once again, a one-time fee and needs to result in an actual birth. And so the doula is not going to be able to drop a claim for false delivery, et cetera. And then the pilot also allows for up to 4 postpartum visits, and those are also $30 a session. And so if the mother goes through 3 antepartum visits, assistance through labor and delivery, and also 4 postpartum visits, the total maximum reimbursement for the doula would be $510.
Thank you. Question is, can the New York State Department of Health provide HIPAA training for doulas?
Not have a HIPAA training that we ask for providers to go through, but what we can do is take that back and see what some of our other providers have done in the past regarding HIPAA confidentiality training and see if there's any ways that we can point folks to those resources.
Is it okay to leave the field license number blank? Doulas usually have their certification and an NPI number only. And yes, when you look at the instructions, I mentioned that earlier, it does tell you you can leave the license information blank. Let's see, next, how are the impact outcomes being measured? What metrics do you need from us to do so?
There are a series of metrics that we're currently evaluating, and so we're going to be sending out actually surveys to both the doulas and to the Medicaid members. One of the things that we're going to be looking at is obviously first and foremost satisfaction with the pilot. So we'll be asking a series of questions of both the doula and the Medicaid member, kind of what has been their experience to date regarding the participation in the Medicaid pilot. We'll also be diving into some more concrete measures in terms of if the mother has been able to increase her rates of breastfeeding to the child, if she's been able to adhere to some more postpartum visits, et cetera. So those are all going to be metrics that are collected in a series of evaluation surveys that will be going out to the mothers and the doulas. We anticipate that the first survey would go out to the mother 4 to 6 weeks after the birth of her child, and then there'll be a subsequent survey that will go out at 6 months to kind of hit at some more of the postpartum visit questions.
Okay. Question here is, for the location of service, if the service is provided at the hospital, birth, or clinic, prenatal visit, what would we put on that form? I guess the enrollment application at this point. Someone, I think they're asking in part, would they have to list hospital as a service address on their enrollment application?
So we do know that there are some doulas who are associated with a particular hospital, and that's where they do their business. And in those instances, it's hard for the doula to provide an antepartum visit, but they certainly are able to provide some assistance at labor and delivery, and may also be doing some postpartum visits at that hospital. If the hospital is at sole location for where that doula provides services, then they would probably list that hospital as a service area, unless my colleagues at CSRA think otherwise.
Could more than defer to DOH for specifics on that. Next is, if the client receives Medicaid after we begin services or after the labor and delivery, is it able to be backdated?
Could you repeat that question for me one more time?
Sure. Someone's asking, if the client receives Medicaid after we begin services or after the labor and delivery, is it able to be back?
To the criteria for involvement in the pilot. So our pilot criteria is that the mother has to be Medicaid eligible and reside in the areas of the pilot. And so she would need to be enrolled in Medicaid already in order to receive the services for the pilot.
Next question is this reimbursement only for doulas living in specified counties and zip codes? And I think you just answered that as well.
Yeah, the doula doesn't have to necessarily reside in the area of that pilot area. Only the mother needs to reside in that pilot area. So if there was a doula who, for example, lived in Niagara Falls and wanted to come in and provide services in Buffalo, she could do so, or he could do so, just as long as that mother resided in Buffalo during the scope of the pilot.
Okay. As far as billing and having a backup doula, would our backup doula have to be enrolled in the program as well in order to receive payment? For example, if they were to stand in at a birth.
Yes.
Okay. Also, the cultural competency training. Can New York State DOH make webinar trainings available for doulas?
Department of Health is going to provide any type of doula training. The only trainings that we're going to provide are for enrollment and for billing and claiming for services.
Okay. If a birth results in a C-section, can the doula still bill for the birth?
Results in an actual birth, yes, she can or he can bill for labor and delivery.
Okay. Next question, do we bill individually after visit?
You would bill individually after each visit, and I believe there's a time frame for when you have to drop the claim. I believe it's 90 days.
Yeah, you have 90 days to drop your claim after the date of service. So as soon after the date of service as you can.
Correct.
But again, it's a billing question, and these billing questions can be answered in future seminars in regards to billings for the doulas.
Follow up on the question we had around HIPAA confidentiality training. As my colleague Kendra was able to find some resources. So there is a HIPAA compliant training available at HHS, that's the Department of Health and Human Services, on their website, and that is free. And so we can send you all the link, Rita, and you can share that on your resources as well.
Okay. This one is asking, depend on survey completion.
There's no hard and fast rule that requires that the mother or the doula has to complete the survey. I know that there have been some programs in which it has been, that's one of the requirements in order for payment to happen, but that's not a requirement for our pilot. Obviously, the more folks who participate with the surveys gives us more data for us to see if this is something that we can continue moving forward within the Medicaid program. So that's the biggest incentive that we can make moving forward, but there is no limit on payment or fees if the survey is incomplete.
Okay. Someone asked a similar question to one asked earlier. Can we bill for C-sections, both emergency and scheduled?
Well, so once again, it depends. The doula would not be billing for the C-section. They would be billing for any kind of assistance or attendance at labor and delivery that results in a birth. So that I just want to be clear about what the doula would actually be submitting to the Medicaid program for. And so the physician or the midwife would be also billing for a vaginal birth or a C-section, but it's the assistance that the doula is providing during labor and delivery that results in a birth. That's what he or she would be billing the Medicaid program for.
Next question says, let's see, is there a limit or restriction on the number of managed care organizations we can sign up with?
A doula can contract with as many MCOs as they think they're able to, and we encourage our doulas to reach out to as many of our managed care organizations as possible, specifically because there are so many of our Medicaid enrollees members that are in managed care organizations and not straight Medicaid or fee-for-service, as we call it here. So we would encourage you all to enroll in as many managed care organizations as possible.
You may want to contact the MCOs as soon as you find out that you're enrolled in Medicaid, because it may take a little more time to enroll with the MCOs than it does with Medicaid. So as soon as you get your information from the New York State Department of Health, I would start to go around to all the managed care organizations and make them aware that you want to enroll into their program as well.
Next we have a question. It says, one of the requirements is proof of having attended at least 2 births. What type of proof is required to show that the doula has attended the required births?
So in this instance, once again, all you have to do is check on the attestation form that you have accomplished that, and then you're signing your signature on the attestation form that verifies that you've actually done that. And so we are taking you at your word that you've accomplished this task, and if for whatever reason that proves to be inaccurate, the responsibility then lies on the person who's enrolled and dealing with those consequences. So we are simply taking you at your word through the document that we provided that you have achieved all of the requirements in order to participate in the doula program, and that is what we're going to be accepting. We're not going to be verifying that or any other requirement on the attestation form.
Are we able to begin the application process, or is December 1st still the date?
First is still the date, but what we have been asking our colleagues at CSRA to do is if folks are ready to go, and it seems like you certainly are, you can begin the application process and they'll just review it and hold it for now, and then, our colleagues that provide enrollment, will accept the application now, and then starting December 1st, we'll start moving those forward in the official approval process. One of the things that we're encouraging folks to do now, which is why we're holding webinars before December 1st, is that as you go through this process and encounter any challenges, we want you to reach out to our colleagues at CSRA and provide enrollment sooner rather than later in order to make sure that you have a hopefully less challenging process as possible.
Another question goes back again to the form, the enrollment form itself. Should we list all places that we might do services at as a place of service, as a service address?
I don't think if you're providing services to the beneficiaries, you may be doing it in their home, you may meet at a cafe. I'm not sure where you're going to be providing these services. I think the most important address is your address.
Okay, thank you. Followed up on backup doula question. They say, so would we list the backup doula on our forms?
Doula would normally be a doula, I would imagine, right? So if they want to provide service to a Medicaid enrolled beneficiary, I would imagine they would have to enroll in the Medicaid program as a doula pilot provider.
Okay. Is there a deadline for doulas to enroll in the pilot program?
No. At all times throughout the duration of our pilot to enroll into the Medicaid program.
The sooner you enroll, the sooner you can start to service the client. So,
Question says, can we still charge our private paying clients at our current rate?
Yes.
Someone's asking me, in addition to when can we start sending in the applications, we've answered that. How long will it take to get the MMIS ID number? So basically, how long will it take to application process?
We have worked very closely with our colleagues in provider enrollment regarding the way in which we're going to be accepting applications for the Medicaid pilot, and so they know this is a priority, and they have been very gracious in terms of creating new systems for accepting the applications for the Medicaid doula pilot. We don't anticipate the turnaround being longer than a few weeks, but that's under the, once again, as Rita stated throughout the training, that's, if all the information is correct, nothing's been omitted, that you have, filled out all of the fields, and that you have completed all of the forms as completely and as thoroughly as possible. If for whatever reason there is something wrong or amiss on your application or on one of the forms that you submit to us, then obviously that's going to increase the time that it's going to take for you to receive your MMIS number.
Okay. I asked, in the NPES site, taxonomy for doula.
Taxonomy.
I know that.
For out-of-state providers.
So, Nadra, my colleague, is going to comment on that one.
Taxonomy codes are usually used for out-of-state providers, so that won't be a requirement.
And please clarify. I thought the attestation form was for those who did not have certs from training. All enrollees need attestation form?
So this is one of the reasons why we have the attestation form is because, as many of you know, there is no national certifying organization for doulas. There are multiple certifying organizations, all with their own different standards and how they train their doulas. We are not going to be providing any kind of national or statewide training process for doulas to go through. What we are saying is that these are the minimum requirements that a doula is going to have to be able to be trained in or undergo in order to participate in our pilot. And we think that many of the programs that we looked at, the training programs, would cover those requirements. And so in many instances, a doula will be able to check off all of those requirements and submit their training certificate, and that would suffice for the application process. If the doula can check off all of those requirements but does not have their training certificate for whatever reason, then they would have to receive a letter from their training organization on their organization's letterhead stating that they have been trained in all of the competencies that we've listed on the attestation form.
Okay. Do you reimburse for transportation or parking? And I think you already answered that by telling what we do reimburse for.
Right, and we do not reimburse, just to be as explicit as possible, we do not reimburse for transportation for the doula to their clients.
Okay.
Also, I would also add, though, that Medicaid transportation is available for Medicaid enrollees as they go to their visits. That's a normal covered benefit that we would also include for this pilot.
Okay, and we only have a couple of other questions here, it looks like. What are the payment rates mentioned anticipated to remain the same if the pilot is formalized?
Repeat that, please.
Yes. Are the payment rates mentioned anticipated to remain the same if the pilot is successful and formalized?
Determined. We are far too soon in the process to even have that conversation yet, but it will certainly be something. If the pilot is successful and we do decide to continue it or even expand it, that would certainly be a conversation that we revisit.
Okay. What to assure that the doulas in the pilot have the appropriate cultural competency to manage the nuances of these high-need populations towards successful outcomes? Are you screening for this in their training background?
So as we've discussed in previous webinars and as we will continue to discuss in subsequent webinars regarding the doula pilot, there is no hard and fast cultural competency requirement. The department does not have a defined program or definition for what cultural competency is, but we would certainly expect that the doula would be able to provide culturally sensitive and linguistically competent services to the communities that they're serving. That will be defined by he or she who's going to be enrolling in the program. We are leaving up to the Medicaid enrollee to determine what he or she's needs are in order to best serve the communities that they're going to be working in. And so there may be some long-term doulas who have been working in the field for decades and may not require learning more about the communities that they're going to be serving, or there may be some new doulas who are new and may not have many cultural links on linguistic competencies with the communities that they're going to be serving, and that will require some additional assistance in that arena. But to the extent that the Department of Health will be screening for particular elements of cultural competency, the answer to that is no.
And I think we're down to one of the last questions here. And it goes back to backup doulas, let's say. Had to use a backup for the delivery, can we only bill ante and postpartum visits?
So the limit of services is dependent on the mother, right? It really does rest with the mother. So the mother can receive only 3 antepartum visits, assistance at one time at the labor and delivery, and 4 postpartum visits. Now, if there are multiple doulas involved in that, that's fine, but they can, at the end of the day, the mother will only receive those 3 antepartum visits, those 4 postpartum visits, and the labor and the delivery assistance. And so we just want to be very clear about if there are doulas that have backup doulas or are working in a larger practice and be able to help each other out, because I know that there are always complications regarding pregnancy. That's totally fine, and we welcome that, but we also want to be very clear with folks that only those 3 antepartum visits, those 4 postpartum visits, and that 1 visit will be billed by to the Medicaid program. And Kendra, is there anything else you want to add to that?
Yes, the doula must be enrolled.
Yes.
Correct.
Yes.
And the doula providing the service is the doula that would be billing.
Yes, absolutely. So thank you, Kendra. So all the doulas who would be participating with the mother, they would have to be enrolled in the Medicaid program as well in order to participate in the Medicaid program. And each of those doulas would be responsible for dropping their individual claim to the Medicaid program.
Okay. The senior is going back to this again. If a doula is present in labor but misses the delivery, or must the doula be present for the actual delivery?
They would have to be present for the actual delivery.
Okay.
So I just want to clarify, I understand that there are some obviously extenuating circumstances, and folks have already informed us of the many hours in which it takes to deliver a child. I totally understand that. But at the end of the day, if the doula is not present for the delivery of the child, then she or he cannot drop a claim for labor and delivery.
There are some questions that seem to relate to billing, and again, we'll be holding some sessions that discuss billing as you get closer to becoming providers and being ready to bill Medicaid. One of the questions here was related to billing, and it was about approximately how long does it take to receive Medicaid reimbursement. Well, from the time you submit a claim to New York Medicaid, depending on how you submit it, to the time you actually have the money in your bank account or you have the check, I usually tell people it takes about 3.5 to 4 weeks, roughly, from the time you actually submit the claim. And that's assuming that you did everything correctly. If you make mistakes, then that can be delayed. So that's kind of just a general, kind of ballpark there. And I think we've hit our hour here. I'm just looking at more questions. And I don't think that we really haven't touched on already. One is the $510 gross or net? Are taxes taken out of this? And
Gross. That's a gross payment.
Don't take any taxes out of the money we pay.
Yeah, we don't touch that.
Well, you will have to pay taxes to Uncle Sam, I'm sure.
$199 at the end of the year, saying how much we paid out that year. That's all I see here for questions, gentlemen and ladies. So, is there anything else you want to add to today's presentation before we close?
I just want to say thank you, everybody, for participating in the first of what will be a series of webinars. Once again, please pay close attention to the DOH website and also to CSRA's website for future webinar trainings. And we look forward to working with you as we implement this new exciting opportunity for Medicaid mothers in New York State. Thank you so much.
Thank you, and we appreciate your attendance. Close. Thank you again.